Hello, everyone, and welcome to the Smart Women Savvy Money monthly webinar series. My name is Derenda King, and I'm one of the advisors here at Urban Wealth Management, where we focus on helping our clients get their financial lives in gear. Now, I want to say at the outset that this is actually a re-recording of the original webinar because unfortunately we had some audio difficulties at the beginning, and so we've made the decision to re-record it. However, we had some really great questions at the end, and so I will be sure to restate those questions and provide my responses to them. If you are joining us for the first time, if you're a new listener, thank you so very much for taking time out of presumably your very busy schedule to be with us today. And if you are a returning listener, we thank you as well for spending time with us yet again. For those of you who are new listeners, or even as a refresher to those of you who are returning listeners, we provide these webinars, again, on a monthly basis. We do them 11 times out of the year, so the only month that we don't host them is in December. And they are designed to not only provide financial information, but lifestyle information as well. And they're also designed to be short, hence the 30 minutes. But also, although they're short, we also intend for them to be very impactful and hopefully very informative. And so for a schedule of our upcoming webinars or any other events that we may have throughout the year, you can go to our website and click on the Events tab, and you will see all of our upcoming webinars. And so you can see that beginning August 8th, our next webinar is going to be on the basics of reverse mortgages and how they can be a key component of an estate plan. And then in September, we're going to continue the discussion around long-term care, but specifically focusing on creating a caregiving plan and how you can begin to have those conversations with your loved ones. And then in October, we will have our very own Diane Manuel host a webinar where she'll be helping you face your money fears so that you'll ultimately be able to begin your journey of creating and building and accumulating your wealth. And then finally, in November, we will have our final presentation where we will have a real estate professional come, and she'll address some questions or bring up some questions or introduce some questions, I should say, that you should be asking yourself if you're interested or even considering becoming a real estate investor or investing in real estate. If you by chance missed some of our past webinars, you can click on the View Past Events. You can see a listing of all of the webinars that we've had in the past, and most of them, if you click on them, you'll be able to access them, the replay to them, and if not, then you can certainly email us or give us a call, and we'd be happy to send that to you. And then finally, we also encourage you to take a look at our blogs. We are regularly adding content and updating them and providing hopefully information that is beneficial and relevant to you and your family. All right, so I have the pleasure of hosting today's webinar, and it is on long-term care for you and your loved ones. And so we're going to be going over the ins and outs of long-term care, meaning what is it, why you may want it, and how it can benefit you and your family. Now I have quite a bit of information that I'm trying to pack into these next 20-25 minutes or so. But before I dive right in, I want to remind everyone that you're going to receive a replay link of this webinar. So if you missed something, no need to worry. You'll be able to go back and review it at your convenience. Also, I want to remind everyone that the material that I'm presenting today is for informational purposes only, and it does not constitute an endorsement of any specific investment. All right. So I wanted to get started by sharing David and Linda's long-term care story. So they were a married couple, and in the earlier stages of their marriage, they weren't always really smart with their money, but they worked really hard, and they managed to build a nest egg totaling somewhere around $300,000. And then when David was 71 years old, sometime around that time, he was diagnosed with the early stages of Parkinson's disease. And in the beginning, Linda was able to handle him. She was able to take care of him on her own, but then eventually she had to tap into their nest egg so that she can hire a healthcare aide to offer her some assistance with David for a few hours a day. And then unfortunately, the time came where he had to be admitted into a nursing home because his condition continued to progress and get worse. And he stayed in the nursing home for about 5 years until he ultimately passed away. And now Linda, she's 72, she's pretty vibrant, she's competent, she's very healthy for her age, but she's had to go back to work because she's pretty much exhausted all of the savings or the nest egg that she and David had built for themselves to pay for all of the nursing home care. So why did I want to start out by sharing this story, or more importantly, what is it that I want to point out? And the first thing is that undoubtedly, long-term care can be a very emotionally charged topic or issue for most folks. And the reason for that is because no one wants to think about themselves or even their loved ones reaching a point in their lives where they're unable to take care of themselves or incapable of living on their own. Secondly, unfortunately, David and Linda's story is also not unique. It's happening to folks every day or every year. And so if you want to get ahead, or plan ahead rather, and make sure that you have a plan in place in the event that you face a similar situation or similar issues and you want to protect your nest egg, then it's really important for you to have long-term care protection in place. The other point that I really want to emphasize is that we're all going to be affected by long-term care at some point in our lives. And the reason for that is because either you yourself will need it, or a loved one will need it, or you'll pay for it in the form of taxes for someone else that needs long-term care assistance. Now, although we are all going to be impacted in one way, shape, or form, the reality is that long-term care is truly a woman's issue. And the reason for that can be summed up in two words, and that's longevity and caregiving. So unfortunately, we as women are affected twice by long-term care. The first reason is because we're typically the primary caregivers for our family members that are in need of long-term care assistance. And then secondly, we are likely going to be the recipients of long-term care ourselves, as highlighted, I think, by some of the statistics that I have here on the slide. The first of which is that we have a longer lifespan than men. We outlive them by an average of 5 years. Also, as I mentioned, the primary caregivers are women. About 2/3 are unpaid informal caregivers. We also have higher rates of disability and chronic health problems in our later years, our senior years. And we make up more than half, and actually close to about 2/3 of the residents that are living in either nursing home facilities or assisted living facilities. And then almost 2/3 of Americans that are diagnosed with Alzheimer's disease are women. To add to that, Other financial challenges that we as women face that impacts long-term care include the gender wage gap, meaning that here we are in 2019 and we still make or earn less on the dollar than men. And as a result, we end up needing to stay in the workforce 10 years longer than men to earn the same amount of income. And as I have alluded to, again, we experience or tend to experience more interruptions in our careers because we're stopping out to either have children or raise children and or to care for family members. And so all of this impacts not only our ability to save for retirement, but also our ability to pay for long-term care expenses. And then finally, there are more single women living in the U.S. today than ever before in our history. And again, women are either single because they've outlived a spouse and so they are widowed, or perhaps they have never gotten married before, or they are divorced, or they're separated. And so what this translates into is there's a greater likelihood of us as women living alone in our elder or senior years. And that also means that we have fewer income sources to rely on, which again makes it really imperative that we have a long-term care protection plan in place. So what exactly is long-term care? So what most people don't realize is that there are actually two different kinds of health care. So there's your traditional health care and then there's long-term care. So your traditional health care is going to provide coverage for your doctor's visits, your hospital stays, any surgeries that you may have, etc. And it's usually going to be paid for by any medical insurance that you have, such as an HMO or a PPO. Long-term care, on the other hand, is services and support systems that are designed to meet your personal care needs that you may no longer be able to perform on your own, and usually it's going to be due to the normal aging process. And so most long-term care is not medical care, but rather it's assistance with your basic everyday normal tasks. And those normal tasks, or everyday tasks, I should say, are actually referred to or sometimes referred to as activities of daily living, or ADLs for short. And there are 6 ADLs, and what they are, or what they mean rather, is the inability to feed yourself, the inability to use the restroom on your own, the inability to transfer to and from, say, for example, a bed to a chair or vice versa, the inability to bathe yourself, to dress yourself, or to maintain bladder functioning. Now, a good way to assess whether or not you or a loved one is in need of long-term care is if you are unable to perform at least 2 out of these 6 ADLs. All right, so now that I've given you a definition or explained a little bit more about what long-term care actually is, I want to now turn to some important questions that you should be asking yourself. And that's the who, the what, the where, and the how. So who will provide the care? What type of care will be needed? Where will the care be provided? And then the how. How much will it cost, and how are you going to pay for it? So first, let's start with who will provide the care, and that can actually be divided up into 2 different camps. There's your community-based caregivers, and then there are your long-term care facilities. So your community-based caregivers are going to be primarily comprised of your unpaid caregivers. Again, those are primarily women, and they're predominantly going to be either family members or friends or even perhaps volunteers. And then you have your home health care aides, as well as adult day care services that not only assist you with those personal everyday tasks, but they also provide social services as well. And then there are your long-term care facilities. And there are 2 types. There's your nursing homes, and then there are your assisted living facilities. And so both types of facilities are going to assist residents with those ADLs, or those personal everyday tasks. However, the main difference between the two is that residents of nursing homes are going to need around-the-clock care or constant monitoring because they're typically going to have more complex health care conditions or issues that are therefore going to require them to have assistance or need assistance with skilled care, and I'm going to define that in more detail in a moment. Conversely, with your assisted living facilities, the residents of those facilities don't require that around-the-clock care or constant monitoring, but they do require care with those everyday tasks, again, those ADLs. So that's referred to, again, as custodial care. So let's break down, once again, skilled care and custodial care. So skilled care is what is defined as medically necessary care that has to be provided by or supervised by a licensed medical professional. And it typically costs more than it does to provide custodial care. Custodial care, again, is needing assistance with those everyday tasks, those ADLs that I mentioned, the eating, the bathing, the dressing yourself, etc. And it's really important for you to understand the distinctions between these two, particularly when I share information about the various options regarding how to pay for long-term care. With regards to where it will be provided, we've kind of touched on these a little bit. Again, those are going to be your assisted living facilities, your nursing homes. They can also be provided at home through various community services, as I mentioned, the adult daycares or senior citizen centers. And one that I haven't mentioned is that they can also be provided through retirement communities. Now let's talk a little bit about the cost because they can be quite daunting. So the first thing that I want to point out is that there's a 70% chance of someone who is turning 65 today, there's a 70% chance that they will need long-term care at some point in their lifetime. Also, women require long-term care for longer periods of time than men. So on average, almost 4 years, 3.7 years, and for a man, 2.2 years. On the slide, I also have put some annual median cost by type of facility so that you can get an idea of what those average costs may be in the state of California. And you can see that they range anywhere from just over $20,000 a year to just over $100,000 a year. So again, it can be quite expensive. So now let's look at how people usually go about paying for it. And either they are going to pay for it out of their personal resources or family and friends are going to chip in. Some folks think that Medicare will pay for it or Medicaid will pay for it. And then also you can pay for these expenses via long-term care insurance. So I want to start out with giving you an example of how quickly your personal resources can be exhausted if you are thinking of paying for long-term care expenses with your personal resources. So in this example, it's assuming that someone's long-term care expenses total roughly $6,000 a month. And you can see that if they had $100,000 worth of retirement savings, that it would only last them a year and 4 months. And remember in the previous slide, I mentioned that women require long-term care for a longer duration than men, about 3.7 years in comparison to men with just over 2 years. So you can see that if you only had $100,000 and if you were a woman, it would not cover the average period of duration. $200,000 would cover it for a man, and for a woman, you can see that you would need close to $300,000 to cover your long-term care expenses if you were needing care for that average duration period. And this doesn't take into consideration if you live beyond 4 years. What if you lived 5 years or 7 years, right? So again, I think this example or hypothetical example illustrates how quickly you can exhaust your personal resources. I also wanted to talk about some public or government programs, the two being Medicare and Medicaid. So I'm going to first talk about Medicare. So unfortunately, a lot of folks think that or assume that, hey, I don't need to pay for long-term care because Medicare is going to take care of it. And unfortunately, that is an inaccurate or incorrect assumption. Now, while Medicare will pay some expenses related to long-term care, there are very specific rules around what they're going to pay for, and they're actually pretty rigid, and I've listed some of them on the screen here. The first of which is that in order for Medicare to pay for any long-term care expenses, you must first be admitted to a hospital. You must stay there for at least 3 days, and those 3 days do not include the day that you are discharged. You also must be admitted to a Medicare certified nursing facility within 30 days of that hospital stay. And here is where, when I said it a few slides ago, that it's really important for you to understand the difference between skilled care and custodial care. Again, skilled care is that care that has to be, it's medically necessary care that has to be provided by a licensed healthcare professional, or at the very least supervised by a licensed healthcare professional. And so Medicare is only going to pay for expenses related to skilled care, not custodial care. So again, if you needed assistance with those ADLs, those basic everyday tasks, the eating, the drinking, the dressing, or bathing yourself, for example, you are 100% responsible for all the costs associated with custodial care. Now, as it pertains to the skilled care, Medicare, again, they're very specific about what they're going to cover. And so any costs related to skilled care, Medicare will pay 100% for the first 20 days. Day 21 through day 100, you are responsible for a co-payment, and for 2019, that amount is $170.50, and that number increases annually. And then day 101, you are responsible for 100% of the cost. And so this is why, again, the assumption that Medicare is going to pay for long-term care expenses is inaccurate, and also why you don't want to rely on Medicare as a source of long-term care expense coverage. And then there is Medicaid, which is more commonly known in California as Medi-Cal. And this type of program is really for your low-income folks, the folks that are pretty much at or below the poverty line. Even with Medi-Cal, again, they also have some specific rules about what they're going to actually cover. So one of the rules is that you cannot have an asset limit exceeding $2,000 for a single individual or $3,000 for a couple. And those assets that they count include your savings accounts, any investment accounts that you have, or any cash value that you may have in a life insurance policy that exceeds $1,500. Now, they do have some assets that they exempt from the calculation, or rather for eligibility, and that includes your primary residence, any household goods that you may have, such as your furniture, as well as your automobile. But the main thing that I really want to highlight here is that this is, again, a program for your very low income individuals. And again, they have very specific rules regarding, what they're going to pay for with regards to long-term care. They will only pay for medically necessary care, which is more than likely going to be skilled care. And even when it comes to the custodial care, I believe that you have to be unable to perform 3 or 4 of the ADLs. All right, so let's talk a little bit about long-term care insurance. There are a number of different options, beginning with your traditional individual policies. They work much like your auto insurance in that you pay a premium for them so that in the event you have a long-term care event that it'll cover the cost. But it's a use it or lose it. So similar again to your auto policy, you pay a premium so that in the event you have an automobile accident that any damages are covered. As with the traditional individual policies, again, you pay the premium. You have a long-term care event, it'll pay for those expenses, but you don't get the premiums back if you don't have a long-term care event. You can also get them through your employer. Many employers will offer them as a employee benefit. So the next time you have your open enrollment, I encourage you to look and see if your employer offers it as a benefit. Professional associations also offer them to their members at a discounted rate. Some retirement communities will offer them. And there are benefits also available through certain life insurance and annuity policies. Now, long-term care insurance, just to be clear, it'll cover all of the different types of facilities that we've discussed, the assisted living, adult daycare, nursing home care, in-home care. Some of them will also cover hospice care or any modifications that you need to make to your home. For example, if you needed to add a ramp because you're in a wheelchair, some policies will cover that or a portion of it. I just quickly wanted to address some of the common misconceptions about long-term care insurance, the first of which is that it's only appropriate for people who have a significant amount of assets to protect. Now, while it's true that your middle income and your higher net worth individuals certainly run the risk of depleting their assets, particularly in the event that they have an extended long-term care need, that doesn't mean that lower income folks cannot benefit from long-term care insurance. In fact, if you really want the ability to maintain control over your care and you're a lower income individual, then you can certainly benefit from long-term care insurance because this will prevent you from having to rely on the government or anyone else for that matter to take care of you. The second misconception is that it should be purchased when you're young. And yes, when you're younger and you purchase these policies, you tend to benefit from lower premium rates. However, the best time to purchase or to consider purchasing long-term care insurance is when you're about to enter retirement or when you're in retirement. It could be cost prohibitive actually in some instances if you're purchasing it at too young of an age. And then finally, it's too expensive. Now, I just went over a variety of different options. And so what that means is that because there are a number of different options, there is a number of flexibility with each of these different types of policies as it pertains to cost. And it's also going to depend on the types of benefits that you select. So don't assume that it's going to be too expensive. It really is going to depend on the type of policy you have and, again, the type of benefits that you choose. All right, so we've come to the end, and I just wanted to share some closing thoughts as they pertain to reasons why you should consider having long-term care protection. The first of which is, again, with women, we have a longer life expectancy than men. And not only that, but we spend nearly twice as many years in need of long-term care. Also, we are the nation's caregivers. So again, if you have long-term care insurance for yourself or for your loved one or some type of long-term care plan, whether it's insurance or not, essentially, you're preventing someone else from having to perhaps discontinue working to take care of you. And then finally, well, not finally, but next I should say, if you are a woman living alone, then it's really important for you to consider long-term care protection as well. Because again, as I mentioned before, we tend to, because we're spending our senior years oftentimes alone and without a partner, there's very few resources or income sources that we have to rely on, and so that often renders us unable to pay for long-term care expenses, which also makes us highly vulnerable to poverty. If you're married, then it's especially important that you consider shared long-term care protection. Just think about Linda and David, the couple, the story that I shared with you at the beginning of the presentation, and how they could have benefited from shared long-term care protection. And then finally, probably one of the best reasons, if not the most important reason to have a long-term care protection plan in place is so that you will not have to rely on family members or the government or anyone for that matter for your care, and also so that you can remain in control of your care, meaning while you're still competent and while you're still arguably in your higher earning years as it pertains to your income, where you can choose the type of protection plan you want, one that's affordable for you. So again, you don't have to rely on anyone else to take care of you. Okay. If you are interested in speaking to any of us to do a deeper dive into your individual long-term care needs or any other financial concerns that you may have, you can go to our website and you can schedule a complimentary 30-minute call. We'll be happy to speak with you again about your individual long-term care needs. Or you can also give us a call rather, and we'll be happy to follow up with you to schedule that 30-minute complimentary call. All right, so now we turn to the part where folks had quite a bit of questions. And let's see, the first question was how do you find a healthcare assistant? And so what I mentioned in the original recording was that AARP is a great resource, or maybe a great resource. And as I think more about it, to add to that, you may also want to check with your local elder care agency. And there's also a website that you may want to peruse, and that's eldercare.gov, www.eldercare.gov. And then also you may want to check with your own primary care physician or that of your loved one, because they may be able to point you to some additional resources. The next question was, what is the average cost for long-term care policies? And unfortunately, there is no average cost, at least that I know of. It's really truly going to depend on the type of policy you have, as well as the benefits that you select. And in addition to that, it's also going to depend on your age at the time that you apply for the policy, as well as your health status. But also to add to that, I would say that generally speaking, your traditional long-term care policies are going to be a little bit less expensive, and also those that are provided by your employers or any professional associations that you may belong to, because again, they offer typically a discounted rate for either employers or for members of professional organizations. The next question was, what product might you suggest for someone who already has a diagnosis, such as diabetes, that might prevent them from qualifying for long-term care? And my response was that I'm not sure that diabetes would automatically render someone ineligible for long-term care, so I would definitely have to look into that to confirm whether or not that's accurate or not. But in the event that it did make them ineligible, then that's where your additional savings is really going to have to come into play, that being your retirement accounts and any other investments that you may have. But also to add to that, again, if your employer offers it, or if you belong to a professional organization, that offers it to their members. They generally don't require a health exam, and so you may be able to get it through them if you are indeed ineligible for the traditional route of getting long-term care insurance. The next question is, or was rather, will this 30-minute consultation assist with zeroing in on specific costs for a specific person? And unfortunately, we won't be able to provide that kind of detailed information. However, we can review the various options with you in greater detail to help you determine what would be the best course of action for you. And then we can request quotes or illustrations to give you an idea of what the premium cost would be. And all of that is complimentary. And then, see, the final question was, can you have more than one long-term care policy? And the answer to that is yes. For example, you can have a traditional individual long-term care policy, but you can also have a life insurance policy that provides long-term care benefits, for example. You just want to make sure that you don't have more coverage than you need. And so, for example, if you had a traditional individual policy, but after doing some research and further consultation, you determine that you actually don't have enough long-term care coverage, then you can look into some other options to cover the gap, okay? Actually, there were a couple more questions. Let's see. Is there a general age at which long-term care becomes cost prohibitive? And there are different schools of thoughts on this. Now, insurance carriers are going to issue long-term care policies, I believe, up until your early 80s. And I actually had a client that was 78, was in great health, and purchased a policy that was actually a really great policy. However, with that said, as I mentioned in the presentation, you generally want to start looking into long-term care policies right around retirement or while you're in retirement. So somewhere, you know, at the earliest around 60, somewhere between 60 and 65. Now, once a person reaches, you know, well into their 70s, then a good long-term care policy becomes, you know, generally pretty expensive. And then also on top of that, it can become difficult to qualify for the coverage if the person has had some health problems. Okay, this was the last question. When you hire someone, is it best to hire them through a company or an individual? And I don't know the answer to that question. However, what I did state in the original recording was that in September, we are going to have a senior care consultant speaking on, again, how to create a caregiving plan. And she will be likely better able to answer this question. And actually, I'll try to make sure that she gets this question so that hopefully she'll be able to answer it in her presentation. So that was all of the questions. Thank you again to all of the folks that were able to join us during the live call. Thank you for staying on despite the technical difficulties that we had. And thank you for all of you that weren't able to join us during the live call but are listening to this now at a later time. As a reminder, if you are interested in, again, diving deeper about your long-term care, your personal long-term care needs, and you want to talk to us about that, you can certainly go to our website to schedule that 30-minute complimentary call, or you can also give us a call and we'll be happy to schedule it for you. And I think that's it. Just want to also remind everyone that our next webinar is on August 8th. And again, it's going to be on reverse mortgages. And so we hope that you are able to join us at that time. Again, thank you to all of you that are joining us on this webinar, either at the live recording or later. And again, we look forward to sharing more information with you in the future through our upcoming webinars. Take care. Bye-bye.